Welcome, everyone, and thank you for joining today's OnBoard Limited Release Phase 3 training for healthcare providers. Please keep your phone lines muted during the presentation. If there is time remaining at the end, we will be taking your questions. Send your questions using the chat box and send to all panelists. Today, we are joined by project leadership and subject matter experts from various areas of the Workers' Compensation Board. To begin the presentation, I'll turn it over to today's presenter, Dapo from the Board's Public Information Office.
Thank you so much, Mike. Today's agenda will begin with an overview of the onboard timeline and administration to be ready for Phase 3. We'll briefly give an overview of what Phase 3 will include. Next, we'll navigate to onboard and provide an example of submitting a few PARs included in Phase 3, the insurer response process, independent medical exam request notifications in onboard, and how to convert confirmation PARs to variance PARs easily in the system. We'll highlight the board's New York Medical Treatment Guidelines in effect with the implementation of Phase 3. The presentation will end with highlighting resources for healthcare providers. OnBoard Limited Release continues its 3-phase rollout. The first phase introduced medication PARs and the submission of the request for decision on unpaid medical bills, Form HP 1.0. And the second phase introduced durable medical equipment PARs. There have been thousands of requests navigating the system successfully each day. Lastly, Phase 3 will introduce the remaining PAR submissions for treatment and testing on Monday, May 2nd, 2022. The PAR types for treatment and testing will be implemented in Phase 3. OBLR will use the information that healthcare providers enter to determine which type of PAR needs to be submitted. MTG confirmation PARs will be used to request confirmation from the insurer that the procedure or test is based on a correct application of the MTGs, which was previously done using the attending doctor's request for optional prior approval and carrier/employer's response, Form MG1. Please note, prior to the implementation of OBLR, MG1s were optional for both the provider and the payer. With the implementation of OBLR, MG1s will continue to be optional for the provider, but if submitted, will be mandatory for the payer. MTG variance PARs will be used to request testing or treatment that varies from the MTGs applicable to the body part or condition being treated, which was previously done using the attending doctor's request for approval of variance and carrier's response, Form MG2. MTG Special Services PAR. MTG Special Services PAR will be used to request authorization for MTG-related special services, which was previously done using the attending doctor's request for authorization and carrier's response, Form C4 Auth. Note, this process will mirror the MTG variance PAR process, rather than the non-MTG over $1,000 PAR process. Non-MTGs over $1,000 PARs will be used for requests for treatment costing over $1,000 for non-MTG body parts, which was previously done using the attending doctor's request for authorization and carrier's response, Form C4 Auth. Non-MTG under or equal to $1,000 PAR. This is new and will be used for requests for treating cost $1,000 or less for non-MTG body parts. This PAR type is optional for the healthcare provider, but if submitted by the provider, a response in OBLR from the payer is mandatory. If you have not set up delegates to draft PARs on your behalf, you can do so at any time. OnBoard Administration ensures you have the proper access to the system, with your assigned delegates ready to draft PARs, which must be reviewed and submitted by the healthcare provider, draft escalations to Level 2 medication PARs, which must be reviewed and submitted by the healthcare provider, draft PAR escalations to Level 3 for medical director's office review, respond to insurer requests for information. Remember, healthcare providers will need to give delegates permission to respond to requests for further information, RFIs, in their dashboard. Instructions on this can be found in the Dashboard Overview Training webpage for healthcare providers. Draft and submit requests for decision on unpaid medical bills, Form HP 1.0. Remember, there is no limit to the number of delegates a provider can use. Delegates will see drafted PARs from other delegates of the same provider, and delegates will need to be added to each provider separately within the medical portal administration pages if they will be a delegate for multiple providers. Let's dive into OnBoard and begin showing how to use OnBoard to successfully submit treatment or testing prior authorization requests. First, we will show you how to access OnBoard Limited Release from the board's website if you have not used OnBoard to submit PARs for Phase 1 or Phase 2. OnBoard Limited Release is accessed through the board's medical portal. If you're not registered for the medical portal, view the medical portal access and administration web pages for healthcare providers. In the teal bar at the top of the board's website, locate the Online Services drop-down list on the right. Select the down arrow to display the list of services and select Medical Portal, then select Login. Enter your medical portal ny.gov ID username and password to log into the medical portal. An OnBoard logo is displayed next to prior authorization request, PAR, and request for decision on unpaid medical bill, Form HP 1.0. These links will take you to your OnBoard dashboard. All prior authorization requests are now done using the prior authorization request PAR link. As mentioned, Phase 3 introduces treatment and testing PARs to OnBoard. These following instructions will detail how to draft and submit a treatment and testing PAR. To submit or draft the treatment testing PAR, including MTG confirmation, MTG variance, MTG special services, non-MTG over 1,000, and non-MTG under or equal to $1,000 PARs, select the Submit a Request button on the top right of your dashboard and select Prior Authorization, PAR. First, whoever is drafting the request will need to complete the information for the provider who will be submitting it. A provider's name will be selected automatically if they are submitting on their own behalf, or if a user is only delegated to draft requests on behalf of one healthcare provider. If a delegated user drafts requests for multiple providers, they must select the provider's name from a list of providers. If the provider only has one medical license, the form will automatically fill in the license information. If there's more than one medical license, select the correct license from the drop-down list, and then the WCB authorization number. Select Claim Search. To begin your claim search, enter the WCB case number or the claim administrator claim number. Next, enter the information for 2 of the following 4 fields: date of injury, last 4 of social security number, date of birth, patient's last name. Then select Search for Claim. If a claim is not matched, check the criteria entered, enter new search criteria, and search again. If there is still no match for a claim, you can continue with the submission by selecting the link to proceed without a matching claim. Then enter the known patient and claim details. After your submission, the board will attempt to match your request with an existing claim. If a claim is found, your request will be forwarded to the insurer's claim administrator for response. If a matching claim is not found within 5 days, your request will be closed and you will be notified. The patient should then be instructed to submit a claim and notify their employer of their injury. When a claim is matched to the search information, search results will be displayed, and you may continue with your request. After conducting the claim search, select the treatment and testing PAR category. Complete the additional fields that appear for treatment/testing category. Begin typing at least 3 characters of the CPT code or description in the CPT code/description field, and then select the correct CPT code from the list. After entering the CPT code description, additional fields are required. Select the MTG site using the drop-down selections. If there is no MTG site associated with the PAR, select None. Begin typing at least 3 characters of the medical treatment guide reference, and then select the correct reference from the list. Enter the body part. Select the side of body, if applicable. If appropriate, select if the treatment/testing is addressed or consistent with the medical treatment guidelines. After the information is entered, select Save. The type of PAR will be determined by the information provided. This example generated an MTG confirmation PAR. If multiple prior authorization requests are being submitted for the patient, they can be added by selecting the Add Another Item button and selecting the appropriate PAR type. The following examples will show how to submit multiple types of treatment/testing PARs for a patient. After selecting Add Another Item, the second request category PAR will show. Select the next category of your submission. In this example, we will be adding an MTG variance. Answer the required questions and select Save. The second request is now added to the submission as request number 2. Select the Add Another Item to continue. Continue entering the information required for the third item in your request for this patient, including CPT code/description, MTG site, MTGs, if applicable. A third prior authorization request of MTG Special Services has been added to the submission. For our example, a fourth item, another MTG variance, was added to the request. Once you move to the next screen to complete the request, you will not be able to make changes to the request details. Confirm all items are added and correct. If you need to change any information previously entered, select the Edit button. If you do not want to submit a requested item, you may remove it. Select the Complete Request button. Because our example included multiple PAR types, you will be prompted to complete and submit each PAR separately, beginning with the first requested PAR type. You can save as a draft by selecting the Save as Draft button on the top right of the page. Your draft will be saved under the Draft eForms tab in your dashboard, where you'll be able to select it and continue completing the request later. If you entered information for multiple PAR types, each PAR will be saved as a separate entry in the Draft eForm queue. Draft eForms are removed if they are not submitted within 30 days from the date they are created. Every PAR submission requires a statement of medical necessity, providing all relevant clinical information to support the request, including narratives, progress notes, and other supporting documentation. For example, symptoms, surgery date if applicable, justification for the equipment, etc. Any contraindications, and if applicable, evaluation of efficacy to continue or extend the use of the treatment or medication. When you submit multiple PAR types for the same patient, the PAR type for the statement of medical necessity that you are adding will show at the top and left side of the page. This example shows PAR MTG confirmation. Select Browse to locate the document on your computer. Enter a description of the document if necessary. Select the Upload button to upload the document. You should receive a confirmation that the document was uploaded successfully. If there are more documents to add to your request, select Upload Additional Documents. To continue with the submission, select the Review and Submit button. Review all details for the MTG confirmation. At the bottom, you can go back to the medical necessity supporting medical page if you need to add more information. You can also select the Preview button to view the entirety of your PAR in a generated document. Once confirmed, the PAR is ready to be submitted. If you are the healthcare provider, select the Attest and Submit button. Provider delegates cannot attest to or submit the PAR. If a delegate created the PAR on your behalf, open the PAR from your draft eForms queue and review the PAR details. You may change the request details and statement of medical necessity, or upload different additional documents if necessary before selecting the Attest and Submit button. As the healthcare provider, you are required to understand all aspects of the attestation presented to you before submitting a PAR. Read the attestation and submission carefully, and then select Submit. A delegated user drafting the PAR on behalf of a healthcare provider will select the Ready to Submit button. This will add the PAR to both the delegated users and the healthcare provider's draft eForm queues with the status of Ready to Submit. The healthcare provider must complete the process by signing and submitting the PAR. Link to healthcare submission portion of webpage. Drafted eForms will be automatically removed from the system after 30 days if they are not submitted. The MTG confirmation submission confirmation page is shown. If more than one PAR type was requested, you will be presented with the next PAR type to complete the details for that PAR. You can see your progress in the column on the left. Follow the same procedure of adding or attaching the statement of medical necessity, reviewing, attesting, and submitting. Each PAR will appear as a separate entry in the draft eForms queue for both the delegated user and the provider. The example here shows that the MTG confirmation is finished, and the submission is currently adding medical necessity information for the MTG Special Services request. Enter or upload a document for the statement of medical necessity. Review the information and then select the Ready to Submit button to finish the MTG Special Services PAR. Your submission will continue on to the next PAR item. When a single submission contains multiple requests of the same PAR type, they will be grouped together as one PAR submission, unless it is a request for multiple types of medication, which are submitted as separate PARs. In this example, we previously entered two MTG variance requests. Enter or upload a document for the statement of medical necessity for both MTG variance requests and select the Review and Submit button. In this example, it shows both of the MTG variance requests ready to be submitted as a single PAR. Select Finish when done submitting all PARs. If a delegated user creates a form on behalf of the healthcare provider, the form will be saved in both the delegated users and the healthcare provider's draft eForm queues. The healthcare provider may receive a notification based upon their notification preferences in their user profile that there is a PAR ready for them to submit. Select the Draft eForm tab from the dashboard, then select the PAR of the form that has a status of Ready to Submit. For this example, we will select the MTG variance PAR that is ready to submit. The provider will review all of the details for the PAR request. The provider may change the request details and statement of medical necessity, or upload different additional documents if necessary, before selecting the Attest and Submit button. After the PAR is submitted by the healthcare provider, the drafted PAR for both the delegated user and the provider will be moved from the Draft eForms tab to the Submitted eForms tab and the Prior Auth Active tab. Within your dashboard, you can view the recently submitted item in the Prior Auth Active tab. The due date column will update with the date the claim administrator is required to respond. All timeframes for claim administrator review and response are automatically tracked by the system. If the claim administrator does not respond within the designated timeframe, an order of the chair may be issued. The Current Activity tab will show the level of review of the request. An initial submission will be Insurer Level 1 Review. The Submitted eForms tab of your dashboard shows all PARs that have been submitted to the claim administrator for review. The Submitted eForms tab shows the submitted MTG confirmation, MTG special services, and MTG variance PARs. There is only one MTG variance PAR because the two MTG variance requests were grouped together into a single PAR. To view the MTG variance submissions, select the PAR ID under the eForm Details column. On the PAR Details page, Request Details will show both MTG variance requests. When a final determination is made on a PAR, it will be moved to the resolved queue. When a PAR contains multiple requests, it will reach final determination once all request items in the PAR have reached a final determination. For example, if one MTG variance is granted and the other MTG variance is denied at the Level 1 review, both requests will move to a Level 2 review, and if escalated by the healthcare provider, to Level 3 review, Board's Medical Director's Office together. Once all requests within the PAR have received final determination, the PAR will be moved to the Resolve tab of the healthcare provider's dashboard. It is recommended to check your Resolve tab for final decisions daily. Next, we will show you what you will see when an insurer responds to your treatment/testing PAR, including PARs that escalate to a Level 2 and Level 3 review, and viewing a Level 3 response. When a claim administrator's reviewer responds to the PAR request, the Active tab on the dashboard will update with the new information and show in bold letters. The provider and any delegates will get an email or text message based on their notification preferences in the OnBoard user's profile, advising that action was taken on their request. If the PAR is denied for an administrative reason only or granted by the claim administrator, or the board's medical director's office issues a notice of decision, the PAR will appear on the Resolve tab. It is recommended that the Resolve tab be checked at least daily for final decisions made on PARs. If any other action is taken on a PAR, it will remain on the Active tab, and the Current Activity column will show the current status. To review the response from the insurer, select the PAR ID link to access the PAR Details page. In the Request Details section on the PAR Details page, select the Level 1 or Level 2 insurer response details as appropriate. PARs that are granted in part or denied at the Level 1 review for medical reasons will be automatically escalated to a Level 2 review. The current activity column on the Active tab will show Insurer Level 2 review, indicating the PAR has been automatically escalated. This review must be done by the claim administrator within the required time frame, shown in the due date column. To view the Insurer Level 1 response, select the PAR ID link, navigate to the Request Details section, and select the Level 1 Insurer Response Details drop-down panel to view the full response details. If a Level 2 reviewer grants the requests, it will appear in the Resolve tab. The Level 2 decision supersedes the Level 1 decision. Treatment testing PARs that are granted in part or denied for medical reasons at the Level 2 review will not be automatically escalated for Level 3 review by the board. MTG PARs can be escalated by the healthcare provider in OBLR, and the Medical Director's Office, MDO, will issue a notice of resolution. Non-MTG under or equal to $1,000 PARs can be escalated by the healthcare provider in OBLR, but will be resolved through the adjudication process. Disagreement over the claim administrator's decision on non-MTG over $1,000 PARs are resolved through the adjudication process. After a Level 2 reviewer has submitted their denial or grant in part, the PAR row will update in bold on the Active tab. The current activity column will show the latest response. Escalating to a Level 3 review needs to be completed within the required time frame indicated in the due date column. In the example below, the current activity is Review Insurer Level 2 denial and may be escalated for Level 3 review by 12/27/2021. To escalate to Level 3 review, select the PAR ID in that item's row. Select the Actions button on the top right of the PAR details page and select Request Level 3 review. Select the item or items you would like to escalate. Enter the reason for the Level 3 escalation in the text box and select Submit. You will receive a confirmation that the escalation to a Level 3 review has been submitted. The escalation to a Level 3 will now appear in your Submitted eForms tab. The eForm name will show the PAR type and the level of request. When the board's MDO makes a decision regarding your request, you will receive a notice of resolution. The determinations by the MDO for medical necessity of MTG-related procedures, DME, or medication requests are final. The PAR will be moved from the prior Auth Active tab to the Resolve tab and will no longer appear in the Active tab. It is recommended to check your Resolve tab for final decisions daily. Selecting the PAR ID link will open the PAR details page. You will be able to view, download, or print the notice of resolution from the document section on this page. When one or more items in an MTG confirmation prior authorization request, PAR, is denied by the payer at Level 2, the healthcare provider has the option to resubmit some or all of the affected items as an MTG variance PAR. This will populate a new draft MTG variance PAR instead of requiring the healthcare provider to re-enter all the data required to create the PAR. Any item in a confirmation PAR that is converted to an MTG variance PAR can no longer be escalated for a Level 3 review by the Medical Director's Office. In your dashboard, when the MTG confirmation has been denied, the font will change to bold. To convert the denied MTG confirmation to an MTG variance, select the PAR ID link. Select the Actions button on the top right of the PAR Details page and select Request Variance. A pop-up will appear to select the MTG confirmation to change to an MTG variance request. If more than one item was included in the MTG confirmation PAR, you can select specific items or select all. Select Submit. After selecting Submit, a new tab will open in your browser. This new tab will contain the new MTG variance PAR. The claim details will be the same as the original MTG confirmation. If details need to change, exit this submission and create a new PAR. To continue with the submission, select Medical Necessity / Supporting Documentation. Enter or upload documentation that supports the MTG variance request. Once added, select Review and Submit. Review the details of the request. If you are the provider delegate, you will select the Ready to Submit button. This will add the PAR to the draft eForms queue with the status of Ready to Submit for all delegated users and the healthcare provider. The healthcare provider must complete the process by signing and submitting the PAR. Drafted eForms will automatically be removed from the system after 30 days if they are not submitted. If you are the provider, select the Attest and Submit button. The provider is required to understand all aspects of the attestation presented to them before submitting a PAR. Select Submit to attest and submit the PAR. A confirmation page will show, confirming your MTG variance PAR submission, which includes the time frame for an expected response. Select Finish when done. The new MTG variance PAR will now show in your Submitted eForms tab. The Active tab on your dashboard will also update with the new MTG variance. If you submit an MTG variance or MTG Special Services prior authorization request, the claim administrator may require that an independent medical exam, IME, be conducted before it responds. If that happens, the claim administrator must notify you, as the requesting healthcare provider, the patient, and the patient's attorney if applicable, within 5 days of the PAR submission date. When the IME requested notification is sent to you in OnBoard, the time frame for the claim administrator to respond will automatically be extended from 15 days to 30 days. This example shows the original due date upon initial submission of the PAR. This example shows that the due date has automatically been extended to allow time for an IME to be conducted. Select the PAR ID link to view the updated information. Under Prior Authorization Request, the IME request status will update from No to Yes. Additionally, a new document will appear within the Documents section. The new form name will show that an IME has been scheduled. Select the Document ID link to view the new document. At the bottom of the document, a new section will be updated, showing the notification that an IME has been requested. If an MTG variance, MTG special services, or non-MTG under $1,000 par is denied due to an IME scheduling related reason, and the treatment or testing is still needed, you may submit another par through OnBoard. This par will go through the same review process by the claim administrator, including another IME if the claim administrator finds it necessary. When the par is denied, it will appear in the Resolve tab of the dashboard. The par status column will update with denied, IME related. After selecting the par ID link to view the par details, a notice will appear in a red box, alerting you that this par has been denied for administrative, jurisdiction, or IME related reasons, and it cannot be escalated for review. To view further details about the denial, select the Request Details section. The denial information can be reviewed within the Request Items section, or the PAR response document found in the Document section of the PAR details. Next, we'll briefly discuss medical treatment guideline updates that coincide with the launch of Phase 3 of OnBoard Limited Release. The board has released training for new and updated New York Medical Treatment Guidelines, MTGs, which will be effective upon the launch of OnBoard Limited Release Phase 3. The list of the medical treatment guidelines that will become effective May 2nd, 2022 are shown here. Providers who wish to earn continuing medical education, CME credits, for these courses will need a Course Mill Learning Management System account to access the training. Each course offers 3 CME credits. Providers who do not need the CME credit may access the non-CME credit versions of the course. Training courses that do not offer CME credits do not require a Course Mill account unless you are an impartial specialist. Training access and full details are available on the medical treatment guideline pages of the board's website. The board has developed a training webpage for healthcare providers. On the OnBoard webpage, a provider-specific card is available, which includes links to an overview of OnBoard, training, and resources. The resources section will provide you with videos, previous webinar recordings, fact sheets, and contact information. The training portion will provide you with training documents similar to today's webinar. This contains everything you need to use OnBoard Limited Release, including the newly posted treatment/testing PAR submission instructions and instructions on changing a confirmation PAR to a variance PAR. These instruction pages feature linked sections on the left side of the page. These will take you directly to these sections to view the instructions you need as you work within OnBoard Limited Release. Before concluding the presentation, we encourage you to visit the System Requirements webpage. OnBoard will run on Windows, Mac, and Linux operating systems via a supported web browser. Supported web browsers include the latest versions of Google Chrome, Mozilla Firefox, Microsoft Edge, Chromium, or Safari. OnBoard Limited Release is not supported on mobile devices at this time. However, OnBoard will include mobile device capability when the system is fully implemented. Internet Explorer 11 will not be supported for OnBoard use. The System Requirements webpage includes links with instructions to update the browser you are using and is available at wcb.ny.gov/onboard. For questions or more information, you can send general onboard questions to onboard@wcb.ny.gov. For other questions, contact customer service at 877-632-4996. We will be sending onboard-related emails through WCB notifications, so make sure to subscribe. Lastly, we encourage you to visit the instructions created at wcb.ny.gov/onboard. These instructions dive into all aspects of OnBoard Limited Release. Thank you again for joining today's webinar. I'll turn it over to Mike for the question and answer session.
Thank you. As a reminder, please send your questions using the chat box and send your questions to all panelists. We'll take a brief moment to review the questions submitted, and we will be back shortly. Thank you.
Mike, this is Dr. Tachi, and I'll jump in to answer the first question that we received. And basically, the question was, why can't the DME provider submit the PAR request? And there's several reasons for this, but first and foremost, and the idea was that the DME provider might know the codes, the CPT codes better. So first and foremost, at the time that the PAR is being submitted, the notion is that the treating provider will know the patient and what their clinical needs will be the best, and therefore the clinical treating provider should be the one best positioned to submit the PAR. We would underscore that the provider submitting the PAR for DME does not have to be an expert in coding. They basically just have to know the type of DME that they're requesting, and the list of codes will then be available to them that they can select from. So they have to know the basic type of DME they're requesting. They need a wheelchair, and then they can select from motorized wheelchairs versus non-motorized wheelchairs, etc. There was a related question: what if the CPT code is not on the list? We're pretty confident that our list of CPT codes is pretty thorough, if not exhaustive. We have done a thorough benchmarking with Medicaid and Medicare, so the code should be there. The first and easiest thing to do is to make sure that if you are using a specific code, that you're using the correct code, because the codes do sometimes change year over year. And once again, we would emphasize that folks do not need to be experts in specific codes. They need to basically understand what it is that they're looking for, and then if the specific code that they're accustomed to using they're not finding, they can select the descriptor that best describes the procedure or treatment, etc., that they're seeking.
Hi, this is Paula Rausch from the Medical Director's Office. We've had multiple questions from attendees regarding not knowing CPT codes when you're requesting. You're not required to know individual CPT codes or memorize them in any way. When you request, it's the same as it is now on an MG2. You would have to request it per modality. So, for example, if you wanted superficial heat and cold, you don't need to know that CPT code. You would just need to type in superficial, and there'll be a drop-down that gives you everything that has that word in it, and you can choose the appropriate modality at that point. Additionally, it's not going to be separate PARs if it's all the same type. So if the PAR type, for example, needs to be a variance based on the questions that you've answered, you have the ability to add additional items to the single PAR. So say you wanted superficial heat and cold, therapeutic exercise, and ultrasound, you could add all three of those to that PAR based on the wording and not necessarily knowing the CPT code.
This is James Wessel with Claims Operations. We've got a couple of questions about paper forms. And to clarify, if a request was submitted using the current forms prior to Monday, May 2nd, those forms will be processed according to the current process. They'll still be scanned into eCase. They still need to be sent to the carrier. The carrier still needs to respond. If they don't respond, an order of the chair may be issued. It's only new requests submitted May 2nd or after that need to go through OnBoard Limited Release, and that if we receive any of those copies, we will be responding back to the provider for a period of time, advising them that the request needs to be resubmitted through OnBoard Limited Release.
Hi, my name is Melissa Beyer-Walters. I'm with the Medical Director's Office as well. There's a question regarding, it says, do providers still have 10 calendar days to request a level 3 review on these PARs? The answer is that there's been no change in the time frames for the providers, so they do still have the 10 calendar days for confirmatory, medication, durable medical equipment, variance, and special services PARs. There's another question. Looks like it says for physical therapy offices. I've seen this a couple times. Their way to request from the providing doctor to put in a new PAR. So all physical therapy PAR requests should be submitted by the physician, the referring provider, I should say. The next question looks like, how can we differentiate between MG1 and MG2? So the answer to this is pretty simple. You don't need to differentiate between an MG1 and MG2. You just answer the questions in OnBoard Limited Release, and it will direct you to the proper form. So all you need to know is if the request is MTG related. Looks like there's another question. Are we able to print a copy of the MG2 variant submissions for our records? The answer to that is yes. When you have any sort of document, the system does allow you to print it.
Hi, there's a question about home health aids, and home health aids, home renovations, jacuzzis, items like that don't go through OnBoard Limited Release. If the claimant is looking for approval to acquire one of those services or items, that would be done by a request for further action RFA form to the board.
This is Jim Touch again. There's a question related to the one that Melissa answered, and that was, can you give examples of when a provider, if they've submitted a MTG confirmation PAR that was denied, when they would submit an MTG variance request versus requesting a level 3 review. Rather than give examples, because there are hundreds of examples throughout the medical treatment guidelines, the easiest way to look at it is that initially, when the provider has submitted an MTG confirmation, again, which is analogous to the former MG1 forms, this is when the provider believes that what they are asking for is consistent with the medical treatment guidelines and doesn't otherwise require a prior authorization, but they would like that optional prior authorization anyway. Okay. So when that gets denied, that's essentially the carrier saying, we don't think that what you are requesting fits into that category. Either it's not consistent with the medical treatment guidelines, and you would have to be requesting a variance from the MTGs, or it's something that specifically requires prior authorization. So if as the provider, you are agreeing with the carrier, right, that, all right, this did not fit into the MTG confirmation category, then rather than having the provider have to resubmit a whole new PAR, as a convenience, we're letting the provider convert that initial request to an MTG variance request instead of a confirmation request. And I suppose if you disagreed that it still was just a confirmation, you could pursue that, but this is more of a convenience to say, okay, this does not fit into the confirmation category. Let me just convert that request to a variance request. A related question, can a delegate submit L3 level 3 review request? And the answer to that is yes.
And there appear to be a couple questions, maybe some confusion about escalation versus auto escalation. If the claim administrator is denying at level 1 for a medical reason, or they're granting in part, their response will automatically escalate to level 2 before it goes back to the provider. If their denial is an administrative reason, like the claim was canceled or settled by Section 32 or is currently controverted, and all of the items in that request are either granted or denied administratively, then it goes back to the provider directly. Otherwise, it escalates to level 2. The provider is then responsible for escalating to level 3 if they are seeking review of a level 2 denial. But there is no scenario where other than medication PARs, there is no scenario where the provider escalates to level 2.
Hi, this is Paula. There's multiple questions, kind of the same topic, about whether or not patients are going to need new authorizations on 5.2 or if prior MG2s and C4s would be valid. If a patient is currently receiving treatment or in a physical therapy program and there is a prior MG2 or C4 Auth that has been granted or approved, the prior approval is not affected by that. It would continue to go through, and then any future treatment that did not meet criteria or needed an authorization would have to go from there. So in summary, if you have an authorization, it's valid until the end of that authorization, and future requests would require a PAR.
This is Jim Tachi. There's a question, can a physical therapist's office, either the physical therapist or one of their delegates, prepare MTG variance requests on behalf of the prescribing providers? And the answer to that is no. So first of all, in terms of the system capabilities, the system will allow physical therapists and physical therapists' offices to do prior authorization requests, but not do variance requests. As to the question, can the physical therapy office act as essentially a delegate of the referring provider's office? Pardon me. The answer to that is that you should not. The board has recently issued guidance that states that there's a very real concern that when say a physical therapist office is doing the PAR requests on behalf of the referring providers, that both the physical therapy office and the referring provider run the risk of running afoul of state and federal anti-kickback laws. So the recommendation is that you not do that. There's another question. How long does it take to get a response once a PAR is submitted? We're in the waning minutes of today's webinar, but very quickly, it depends very much on the type of PAR that has been submitted. So for MTG confirmations, it's 8 business days. For MTG variances, it's 15 calendar days, unless the insurer is going to request an IME or a records review, in which case it's 30 days. That's consistent with general construction law. For MTG special services, it follows the same 15 and 30 calendar day formats, depending again on whether or not the insurance carrier is requesting an IME or a record review. For non-MTG goods and services over $1,000, it's 30 days. For non-MTGs under or equal to $1,000, it's 8 business days. For medication PARs, it's 4 calendar days. And for DME PARs, it's also 4 calendar days.
There's a question regarding delegate access and how it works for a large physician practice who may have multiple staff members. So each individual provider would log into their medical portal administration page and add those delegates as either a provider delegate who can submit HP1s and draft PARs, or a billing delegate who can submit and draft HP1s. So once they add that user, the board will create a user ID for that support staff member, that delegate. If the next provider adds that same user, the access is actually added to that user's existing user ID. So in that case, the support staff member will not have, for example, 5 different user IDs if there's 5 different staff members in the office. They'll be able to log in with that one user ID, and when they're drafting PARs or submitting HP1s, the system will ask them which provider they're submitting on behalf of at that time.
And we have a question here asking if someone can receive a copy of today's webinar. And after this webinar, not today, but either later this week or early next week, we will be sending a follow-up email, which will contain a copy of the slides used, as well as a recording of today's webinar and the other resources available to prep for phase 3. So with that, we will conclude today's webinar. Thank you all for participating. We hope today's webinar helped prepare you for phase 3 of OnBoard Limited Release. If you have any questions following this webinar, you can email onboard@wcb.ny.gov with general questions, or call 877-632-4996 for other questions. If you have not already, subscribe to receive WCB notifications, where we will send all information about OnBoard. Lastly, the new OnBoard webpage contains detailed training information for providers. We encourage you to visit this page to review everything you need to know. At the closing of this webinar, you will be linked to a survey. Your input here is greatly appreciated to help us plan and improve future sessions and update our OnBoard resources. Thank you all again, and have a wonderful day.